The Family Liaison Manager role essentially is there to support and guide families through the journey of finding a care home for a loved one. So I'm Conor. I'm the Family Liaison Manager for Greensleeves Care, and I started working for the organisation in 2024. I started my career in care in 2018 in Banstead in Surrey. Expressing initial interest, you'll have one dedicated point of contact, which is myself. I'm just there to help you through the journey from answering your questions on an initial phone call or an initial email, booking you in to come in and visit one of our homes, then actually being the one to show you around the home, introducing you to members of the team, organising your loved one's pre-move-in assessment and financial assessment, talking you through sort of what the move-in process is then going to look like if you proceeded with us. My role is then to hand over to the amazing teams that work within the home to then take on looking after your loved one. Watching families get their relationships back. It's, talking to sons and daughters and husbands and wives that have essentially taken on this caring role and caring responsibility, and talking to a lot of them about how their roles have changed and they don't really feel like they're husband and wife anymore, or mother and son anymore. It feels a little bit more like they're a carer and a care receiver, and the visits and the time they spend together is all about medication and admin and appointments. The focus within this organisation was care first and foremost, and that's what really stuck out to me. It was the not-for-profit side of things, but it was the fact that at the forefront of every single conversation that is had within this organisation, care is at the forefront, which really stuck out to me as someone who'd already been in the sector, doing this role for a number of years. It was coming into the homes, meeting with the team and seeing how they worked. It was actually care is at the forefront of this organisation, and I think when you're in the care industry, that should always be the priority, which is what I think makes Greensleeves unique. The Home for Life promise assures our family members of our residents that as long as we've had the 18 months or longer of self-funding, if they were to be in that position where they've now run out of the ability to self-fund, we would work with local authority partners to secure funding arrangements, giving you that long-term financial assurance. I'd say that's my number one piece of advice. Make sure that mum or dad or whoever it is that you are concerned about and think needs that bit of extra help, involve them in the process. That's my number one piece of advice from as early as you can. Keep them as part of the conversation.